Carole Osborne, and I'm the author of Pre and Perinatal Massage Therapy, which means that I've worked with a lot of people in side lying position, not only my pregnant clients, but others. And I have found that some therapists, when I'm teaching them how to work here, they're a little daunted by how do we keep the breast area draped. So I want to give you three main options on what I do. And the first one is you'll have to answer the question of when does a pillow become a breast drape? And it becomes a breast drape when you put the pillow over your client's covering sheet, which you can see then holds this covering sheet in place so that when I'm working, actually I'm employing my client to help maintain her breast drape. So that's one option. Another option, if you're concerned about there being any gapping of the sheet that might be opened here on the side, is to take a towel, depending on the client's size. You might want a hand towel like this, or you might want something that's a little larger. And I place that towel down. It helps me to cover her arm if she needs some covering on her arm. And this works well for when I'm working on the client's back, for example. And then a third option that I want to show you is the movement of the breast drape with the pillow in place whenever I'm going to mobilize the shoulder. So this is a great advantage to this position, to be able to move the shoulder. And what I like to do is to, as I bring, for example, I might bring the client's arm over mine so that I can do some movement. I'm going to take this edge of the sheet. Let me move this out of the way so folks can see what I'm doing. And I've taken this edge of the sheet with my hand and brought it in front of her. So her sheet is between my hand and her shoulder. And so now if I want to do some range of motion kinds of movements, right, or if I were going to do some resisted stretches where she brings her shoulder girdle up towards her ear, we'll still have all of that drape covering, because remember, we also had that in place as well. So finally, what I want to address is how we would work with the draping if I wanted to get to, for example, her rib cage or her abdomen. In this case, what we're usually going to do is to take a pillowcase. I recommend using a king-size pillowcase so you have plenty of fabric. So go ahead and just drop your arm here, and if you'll just take that edge of the pillowcase there, I'm moving the pillow out of the way, and you just hold on to that. I'm just going to slide this sheet down. So this is the same type of thing that we do when we have our clients in a supine position, right? They hold the breast drape for us in place as we bring the sheet down. And so if you'll just take that edge of the pillowcase and just tuck it under your arm and between your body and the table. That's great. So then you can see that it's quite easy for me to access the rib cage if I were going to do some rib cage work. Or let's say I had a beautiful round belly here that I wanted to do some work with, right? Or perhaps I were looking for some trigger points on a very athletic person who might have very tight abdominals. This could be a good access point, but the breast area stays covered. So I hope that makes this little challenge way less challenging for you and helps encourage you to take advantage of the side lying position for all of your clients. Thank you.